Good afternoon, everyone, and welcome back to YWCA's community discussion regarding racial and social justice. We're here for another exciting week of conversation and question and answer and, all that good stuff that we've been kind of tackling the past couple weeks. We're really excited for our speaker. I want to reiterate we haven't had any issues, like I say all the time, but just to remain respectful to the other participants and the panelists with our questions and discussion. And I think with that being said, I'll pass it over to Guillaume Stewart, YWCA's Executive Director, and we will jump right in. And Jay, I'm gonna unmute you.
Awesome, can you hear me?
Yep, perfect.
Thank you, Jess. Hi, I'm super excited about this conversation with Dr. Hudson. Our conversations over this summer have been really powerful and important and added so much to our efforts around social justice. So when I found out that Dr. Hudson accepted my invitation to be a part of this discussion, I was super excited. So I just want to begin by saying, hi, how are you? How are you making out? Before we get into your bio, the rich work that you've been doing, how are you making out?
I am hanging in here, I guess, as best as I can and as best as everybody can in such an uncertain time. Personally, professionally, it is just so uncertain to know how to do the work that we do. But we're all in it together. And that really, keeps me, girded up.
Awesome. Yeah, I think just having these kinds of conversations through Zoom, people are finding new ways to connect and to get through it, as you say, and that's really been awesome. I want to read a little bit of your bio, Dr. Hudson. I think it's so much rich experience and wonderful work that you've done in the field of healthcare, also in academia. But I just want to read a little bit of this for our listeners. And I'm going to read right off of my notes because there's so much here and I want to make sure that I cover everything. Karen N. Hudson, PhD, MSW, LSW, has been honored locally and nationally for being strong, for also being a fierce advocate dedicated to eliminating health disparities affecting children and families experiencing homelessness. She is also recognized for being a mentor to these families and teaching the healthcare providers through training and education. Karen serves full-time as program lead of the Children's Hospital of Philadelphia Homeless Health Initiative, an award-winning volunteer health outreach, health promotion program that provides access to free health care and wellness services, health education for families and staff living in shelters. Karen has also been a national advocate on behalf of this vulnerable population. And Karen, I wanted to talk to you a little bit about that. This work that you've done around the homeless community really resonates with us here at the YWCA. We have a passion for that work too. Can you tell us how you got interested in working with homeless families through your role at CHOP?
That's an interesting question, G, and I'll have to say, it's now been 20 years that I've actually been at the helm of this particular program, and it came to me, it was just given to me. I was just told that CHOP has a program where pediatric residents go out to homeless shelters, and that my department was going to be in charge of, working with this program and leading and facilitating it, and that meant me, and so for me, it felt like it was accidental, but at the same time, I have to say, it was like this gift that was given to me that really sort of changed my life in terms of the way I work and the things that I do at CHOP. It provided an opportunity for me to see CHOP in a different way. It wasn't just the service that we provide to patients and families that come into the hospital, but to me, it was really about how do we connect with our local communities, and disenfranchised, vulnerable populations that are sitting right in our backyard. And so that became my mission to try to understand that better. What are we doing? Why are we doing what we're doing? And how can we, again, just sort of break down some of the barriers between families in the community and how they interface with CHOP as a hospital?
Yeah, I think that's really amazing. I know sometimes that population of people, homeless women, homeless kids, homeless men, they can get lost, you know, in the shuffle. And it's so important to pay attention to that population and to try and help meet their needs. In your work, what are some of the experiences of the families that you've connected with through your role at CHOP? What are some of their experiences living in shelter? What are some of the traumas that you've um,
Can you all hear me? Yes? Okay. Um, some of the experiences of the families, they vary because all of the families that I have worked with and seen in shelter, come to shelter or arrive at shelter after having experienced multiple traumas. Traumas including things like experiencing domestic violence or community violence or family discord, substance abuse or mental health issues, family incarceration, food insecurity, and of course, just the experience of homelessness, doubling up, tripling up, moving around from one address to another, not always knowing exactly where you're going to lay your head or for how long. So just the uncertainty of all of that is a traumatic experience for the families that we work with in the shelters all the time. And again, we never know which of these traumas have impacted our families, but we certainly know that everything that led up to them coming to a shelter and now that they're experiencing homelessness and living in a shelter means that they're experiencing trauma. So we
uh,
keep that in mind and with everything that we do with our families. We embed a trauma informed lens and approach to the work that we do, which means we do recognize that families have been through an awful lot in order to get to the shelter where they are right now. And that means that they've also had to experience a great deal of strength and resilience in order to get there. And so that's the place from which we start in terms of any of the work that we do with our families.
yeah, I love that, Dr. Hudson, because I think I'm sitting here thinking to work in a shelter, to work in that population, you have to be tough. You have to be strong because those families go through so much. And I imagine just having someone through your programs that care about them is really important to the kids that you guys serve, to the women, dads that you guys serve. I think that's really awesome. I wanted to talk a little bit too about something just in researching you. I know that you've done research, you've written about the role that fathers play in the shelter system. And I found that to be very interesting because I think oftentimes when we think of homeless families and shelters, we tend to think of women and children. And maybe dads sometimes is again kind of lost in that shuffle. How did you become interested in this? How did you become passionate about this research and the role that fathers play in the shelter system?
That's a really great question, G. And I'll tell you, from the many years of working in the shelter system with these families, what I noticed was that who we saw and who we worked with were women and children. Yet the shelters were called family shelters. And so I just was trying to put that together in my understanding. How is this a family shelter and there are no fathers here? The fathers aren't involved with the kids. And so I began to ask questions about that. I began to observe that, and I began to really wonder why that was. And not only did I see family fathers not living in the shelters with their families, I also saw that they weren't even allowed to visit. They weren't even allowed to visit their children and families during this really traumatic time, and crisis phase for these families. And that was just appalling to me. And again, I began to recognize that all of this really stemmed from the systemic and structural racism that's rooted in the historical separation of fathers from their families. When we think of the legacy of slavery, when we think of how families from the very beginning have been broken and separated, Even post-slavery, when we get into Jim Crow and the Reconstruction, now we've got laws that are really fighting the segregation that was in place, but it's also laws that really led to the economic downturn, and we're not going to help single moms unless they don't have a father with them. So you're excluding fathers yet again. You're saying that the mothers and women have to be on their own, or have to pretend to be on their own in order to get the help in which they deserve and are rightfully belonging to them. But I also began to think about it wasn't even just about the moms, but what about the kids? The kids are living in shelter with all of that goes along with that. And they could use their fathers now more than ever. And here's a time when yet the shelter system, like many other systems, has just discriminated against and really eliminated fathers. And so I did become passionate about that, thinking that it is just not right. This is about children. All the work that we do at Children's Hospital, it's about serving children and families. And here we're in the community serving children and families, and there are no fathers. And so what are we going to do about this? And so that really led me to my doctoral journey and my dissertation research, which was about really trying to learn more about the fathers' roles in parenting their children during this time that kids were in shelter without them. And what I learned really was that these fathers were not as invisible as we all tend to think that they are, that many of these fathers were jumping through lots of hoops to be involved with their children, to see them, to sneak to see them, just to be involved in their children's lives. And so, what came out of that study for me was the importance of not assuming that fathers aren't involved or don't want to be involved. Every situation is different, and maybe some fathers don't want to be and aren't involved, but many do. And so we should be asking the questions about that, and we should be encouraging and supporting fathers to be involved with their children during this time. So post my dissertation work, I took on, was the co-principal investigator in a study that looked at the inclusion, the policy change in Philadelphia to now include fathers in shelters. So after my dissertation work, my role was really about advocating for these fathers, and I went to the city and I said, where are they and why aren't we including them? And, here's my study and this is what I learned. And, I think that we need to do something differently about this. And it was through some of those efforts and others that I think that people were beginning to see that the tide was turning, and that we really needed to bring about this shift and this change of including fathers. And so the city set out to actually change their policies and work with the shelters to do that, so that fathers are now included as residents in family shelters in Philadelphia. In 9 out of the 10 family shelters in Philadelphia, it's now fathers, mother, and children. And I can't be more excited about that. It's better late than never. I mean, we should never have been excluding fathers like we have been, but at least it is a new day. And that gives me hope. It's a new day. And how do we capitalize on this and help these fathers really during this time be an integral part of their children's lives and their families, and take their place within families? So that's how I got involved in this work and this passion.
Yes, I think that that's really powerful. I just want to bring out something that you said, Dr. Hudson, because it resonates with, I think, a conversation that we're having nationally around systemic racism. And we're looking at systems in society, whether it's the police system or the healthcare system or social service systems. We're looking at it and saying, what has been the impact of the legacy of discrimination and segregation and those kinds of things that you highlighted. And it looks like you did a similar thing with the homeless administrators and networks that you work with. I think that's really important. I think can you speak a little bit to how something like slavery, which was hundreds of years ago, could have an impact on a system that you and I participate in 2020? Can you just talk a little for our listeners that I think sometimes we've heard like, well, that was so long ago, that was, hundreds of years ago. it's over, thank God. But some of those things still impact systems in life today.
Absolutely, G. And again, just to underscore, you're absolutely right. It is a legacy of almost intergenerational trauma that continues to impact systems now. So again, as I mentioned, when we talk about post-slavery, we move into Jim Crow, we move into Reconstruction, but we are still in a time where systems are still, even if it's unconsciously, they are still systemically and systematically excluding people of color, Black people, fathers, brown people. They are still excluding these populations. And that has an effect. Even when I think about the homeless population and working with these fathers, how do you think it feels for these children to know that they have a father, but also look up and see that their father didn't come to the shelter with them, or couldn't come to the shelter with them, or can't visit with them? What questions does it leave for a child to think that at a time when their family is this much in crisis, their father is gone, but yet their father wants to be there? So it also has the effect of, again, changing how children see their fathers, when in fact every father is not a father that doesn't want to be involved. There are many fathers that want to be involved, and our work needs to be, as systems, be about encouraging and improving those kinds of connections, because they have long-term implications. If these children don't have good relationships with their fathers, and these relationships are broken, they carry these relationships into their adulthood, and the remnants and the memories of all of this. And it really contributes to how they interact with other people, other men, etc. So that's how it has a lasting impact. Take for example, a program called WIC. Many of our listeners have probably heard of WIC. Well, what does WIC stand for? WIC stands for Women, Infants, and Children. It's a supplemental nutrition program specifically for women to help support the nutrition of their babies and young ones. Well, what does that say to a father when the program is called WIC? You don't see fathers anywhere in the title, yet you may see single young fathers that also have young children or infants, and they're trying to take care of them, and they're trying to seek help and get help for themselves. But yet this is a program that's a federally funded program, but is not really for them necessarily. It's not advertised that way. It's not promoted that way. And things like that just have to change. So sometimes, to me, it feels like it's about language. Even if the WIC program can help single dads, they would not necessarily know this by the name. And if social service providers and helpers aren't encouraging them and leading them to some of these particular resources that they think are just for women, because again, traditionally in social services, many of these systems have been about supporting and promoting and helping women, and not to the exclusion of fathers. And so I think all of us, well-meaning perhaps, but even as helping professionals, we need to change our language, the lens by which we see who needs help and who we decide to help. And so that's how, again, some of the remnants continue and the impact lingers on even today.
Yeah, I think this time in our country's history is, in a certain sense, a way to look into these systems and say, is there things we could have done better to include everyone? You highlighted through your research, through your advocacy work, the role of fathers. But you just brought out the WIC program, which is a great program, but is the language maybe unconsciously excluding a group of people that, so I think this time is really important, because now we're looking at all of these things, looking at all of these systems and saying, how do we fix this? Because you have so much work experience with nonprofit communities, what are your thoughts on the role that nonprofits can play and trying to do some of this advocacy, trying to look at some of these systems and figure out how to make sure that everyone's included and a part of it. How do you see nonprofits playing a role in that?
I think that nonprofits can play a huge role in this, and they have to. However, it starts at the top, even within these nonprofits. There needs to be some re-education because, again, you said it and I said it. I think that some of what we do is unconscious. You know, we all have these biases. You know, we are raised in these systems the way that they have been promulgated and promoted. But it's time to think differently, to think outside of the box, and to think about doing things differently. And for many people who perhaps are working in nonprofits, maybe they've worked in nonprofits for quite a while. And so the old adage is, you know, if it ain't fixed, don't broke it. If you're used to doing it a certain way, then that's the way you want to do it. And you're not really sure why we need to make a change. But change is important, and change needs to happen in order to build a more inclusive society. So the notion of changing our education, reframing how we think about the services that we provide and who we provide them for, who's missing from the table, I think is another way of just sort of reframing and thinking about this. And it's our responsibility to do this. And because change is hard for people, that's why I say it needs to start at the top. If at the top of these nonprofit organizations, they are not recognizing this and supporting their staff to be able to make these changes and be on this journey, then it's not going to happen. If you just tell people something to do, they're not readily going to just do it. I think people need to be educated. They need to understand why we're doing this, and they need to understand the mission of the agency. And if the mission really is clearly about inclusivity, then it means that we all need to rise to the challenge of doing something very differently than we've done it in the past, because it is a new day.
Yes. And I happen to know from just, you know, reading your bio, that education's important to you. So you were a lecturer at the University of Pennsylvania's School of Social Work, also an adjunct professor at Westchester University. So I take it that education is important to you. What role do you see education playing in trying to deal with some of these inequities?
You know, that's a good question. And similarly, I think that it is about education. And as you said, I have a passion for education and for teaching. So one of my roles, even at the hospital, is that I am a part of the LEND program, which is a disability fellowship program. So I work with healthcare professionals, and what I work with them on is community engagement, understanding more about diversity and inclusion, you know, and in this day and age, really promoting and helping them to understand more about racism and anti-racism. And for my social work students that I have taught and continue to teach now, it is the same thing. It is expecting them to really ask the hard, critical questions about who are we serving and who are we not serving. And why. I think that, you know, certainly for social workers, our code of ethics tells us that we should not be excluding people. We should be treating everybody with sensitivity, care, empathy, and we should be seeking to serve everybody that needs help. But I can certainly tell you, I have asked over the last few years, I'm asking all of my social work interns, what are you learning in your social work education about fathers and men and their role within families and society? And I feel as if we as a social work profession have not claimed that in a way that we need to, that we have not pushed the emphasis on including fathers when we talk about families. So again, I think it's the education on every level for educators, for social service professionals, for people working in the community. I do think that education is the key to all of this. And as far as education goes, again, when you're educating, you don't just hand something to somebody and expect them to get it right away. You have to allow people to sort of process education in the ways that they can, that work for them, and give them time in which to do that and support them in their efforts to learn a new language, to learn a different way of thinking and framing. And thinking critically, as I said, about who we're serving and who we're not serving, and asking those hard questions, and just getting committed to a different way of serving and working.
Yeah, I think that that's important. And I just want to share, I think when you and I had talked a few weeks back, I was telling you that you were telling me how important education is, how important it is to work with various students and to teach them and to help them do the things you just described. And I think just sharing with our listeners, this last 6 or 7 weeks of this series, has really been an education, I think, for all of us at the YW. It's been an education around social justice. We've met incredible speakers. We have you here today. But it's also been an education about the role that we can play in trying to fix some of the things that we see, working with other nonprofits and just doing great work. So I just wanted to say that the committee is on the same page with you with the importance of learning, the importance of education, and how that can impact systems. One of the systems that we're thinking about as a country is our police system. Of course, after the murder of George Floyd, that casts new light on a very old problem of how police sometimes relate to communities of color. And we had a lot of different speakers come on and talk about some of the issues surrounding that. I just wanted to ask you some of your thoughts on that situation, on community policing as it relates to people of communities of color.
That is such an important topic to talk about. It's really top, front and center in our news today. And I will also tell you that it feels like it's been front and center in my life, both personally and professionally, when I think of all the things that are happening right now. You know, I, as a Black mother of 2 sons, you know, lived in a community where I felt as if our Black youth were profiled by the police officers here in our community in ways that were just not right. And, you know, it forced me to have to stand up against that and to really try to do something about that. And so for me, that was really about getting more involved in the community, raising community voices. I actually ended up becoming a block captain. I ended up working with the borough and the borough services and law enforcement here in my town with an effort and an emphasis really on building better and stronger relationships between law enforcement here and the youth within our town. And today those efforts continue for sure. And, you know, one of my 2 sons even went on to actually become both a volunteer firefighter in our community and a police officer, to try to diversify the force, to try to make a difference from the other side of things. So for me, again, I see this has really been personal for me, and it continues to be, because, you know, not every police officer is bad. You know, we all know that, you know, and yes, we need police. Surely we do. But what we don't need is, we don't need police or anybody else devaluing the lives of our Black citizens, both men and women. And for me, because I'm just surrounded by Black men personally in my life, sons, grandsons, and my partner, you know, I fear for them every day just because of the way that they could be targeted, they could be viewed just because of the color of their skin. So I think that in a system as large as law enforcement, there are so many different levels to all of this. And so again, it doesn't happen or resonate with just the law enforcement, you know, on the street level, but it goes higher within these institutions. And so that, to me, is where the change needs to happen. It's a cultural shift that needs to take place, and it needs to start from the top, and it needs to embed some accountability into all of that. And any kind of change, monumental change that we're looking for and asking for these days, is not going to happen overnight, for sure. And that's what requires, I think, the steadfast commitment and consistency on all of our parts to keep this conversation going, to keep pushing to hold law enforcement officers accountable for their actions, but to at the same time not feel like we're devaluing the work that they do. We need police, but we need police to value us, and to value the lives of Black Americans and Black men in particular. So those are just some of my thoughts on this.
No, I think that it speaks to kind of what we're trying to figure out now as a country. Like, how do we repair some of the damage done by, you know, George Floyd, Eric Gardner, Breonna Taylor, you know, the list goes on. We want to fix that. We want to make that better. Dr. Hudson, you talked about your son being involved as a firefighter, volunteer firefighter, and also a police officer. So that gives you a unique perspective on law enforcement, and obviously, you know, being a part of a community of color. What kind of diversity was your son able to present or show or help his fellow officers learn by working in law enforcement as a police officer?
Well, I think much like the work that, you know, I've done and continue to do and have done all of my life, you know, in every instance where I've been, you know, I have been one of very few Blacks, you know, at every level of everything that I've done. And so I think no Black person can speak for all Black people or the perspectives of all Black people, but they can allow people to see who they are. They can allow people to learn from them, you know, and these are the things that my son did. You know, he diversified the force in terms of every single police officer is not white. When you're policing these communities that are communities of color, there should be some police officers that look like them. You know, in the same way we think about this even in, or at least I think about this even in social work and the work that we do. You know, if so many of the families and clients and patients and folks that we're working with are Black people or people of color, it ought to be the same that they're working with people that look like them. And I'm not saying that needs to be everybody, but I'm saying that we should be involved in all of this as well. And so I think it's on us to represent by putting ourselves in places and spaces where we can try to make a difference, where we can try to show communities of color that we are here, that we are supporting them, we are assisting them. And again, I think that the work is always done on two levels, on multiple levels. It's really helping individuals, but I think it's also helping larger communities all at the same time.
I want to bring up, I know we're going to have some questions from our listeners, but I want to get a couple more questions in to you. So we've seen mass protests, large-scale protests, people seeking change. I know here in Bucks, we participate, there were a lot of them, you know, positive protests, people coming together. We attended some of them here, you know, at the YW. All of those things were really asking, like, can we see change? But they also bring up, like, where does this experience rank or place within our national history? Because we've seen this, you know, like, you know, our parents in the 60s and, you know, all those efforts. So how do you place this incredible movement of so many people, so many communities coming together asking for change? How do you see this in that context?
I see this as, and I want to believe that what's happening today is really more than a moment, that it is a movement. As you said, when I think about sort of the history of all of this, one of the reasons why Black people are so angry and continue to be is because we have been unjustly served for so very long. And all of our past efforts have not been enough to dismantle racism and to make things, you know, more equitable and fair. And so as a Black person, we are often exhausted by all of this, by the way we're treated, by the work that we're trying to do in terms of making change. And I think that what's different in what's happening today for me, it feels like it's more than just Black people and people of color that are standing up for themselves and really trying to advocate for change. Now we have white people who are getting it and who are seeing this and seeing the racism up close and personal. You know, if they didn't understand it before, it is now so much in their face. Every time you turn on the news, there's something that's happening that you have to wonder, why are these things happening? You know, when I think about this, everything that's happening right now, I have to hold on to the hope and belief that this is more than a moment, that it really is a movement. And the movement, I think, is because there are so many more voices and representation of people that are involved in this movement, and it's beyond just being about Black people.
Yeah, I want to follow up on that because I think that that's an important part of it. When we saw the protests, when we saw the advocacy, when we saw the engagement, it wasn't just people of color. It was white people from across the country saying, you know, oh, this is crazy. You know, this. Can you speak a little bit to how having that support from people that may not look like us, but understand and get that this is not a right thing, how that advances social justice, advance this movement?
The way that it advances, because again, it is more voices. When you're just hearing from Black folks who are advocating for themselves, well, Black folks are already in a position of second-class citizen. We're already in a position where our voices are not being heard. So now the strength is when you're adding other voices, white people's voices and other people's voices to this conversation, it is more than just this is a Black issue. You know, when we begin to think about how the lack of diversity and the way that Black folks have been treated impacts the lives of even white individuals, that's when things will begin to change on some level. Diversity is important for everybody because our communities cannot survive, you know, by just thinking about it's all about white people. It is not. This country is becoming more diverse in terms of the people that are living here, the residents that are here. So we have to be looking for ways to be in this together. And I think the more voices that you're having at the table, the more voices that are saying this is wrong, we need to do something about this, the greater the possibility of some hope in the long run. And again, you know, I'm always thinking about the fact that this is mega social change that is underway currently. And this won't happen overnight. I go back and I think about something like the Montgomery bus boycott in the 50s, you know, in Alabama, you know, all because Rosa Parks was not allowed to sit at the front of the bus, but was told that just because she was Black, she needed to sit at the back of the bus. And she went against that. And the uprising was nonviolent protests, you know, by boycotting riding the buses in Montgomery, Alabama for a whole year. So for people to commit to make a change, to do something different and to not ride the buses, to impact the economic situation in a negative type way, all of that happened, and it happened because people were really consistent in doing it. The hope that I have for today and everything that is happening is twofold. It really is that we've amplified the voices of people concerned about the issues related to Black unjust treatment and trying to dismantle racism, but it's also about thinking on a much larger scale here and being committed to not giving up these conversations and these protests, and, you know, just keep the emphasis going on all of this. And of course, you know, I'd be remiss if I don't say something about the part of the major challenge with all of this and why it's so overwhelming is because this is all happening embedded within a pandemic, a global pandemic, and it's embedded within an economic, you know, downturn that is gripping many people here in this nation, and it's embedded within the overlay of this election that's coming up in November. And so all of these things have to be taken into consideration, and we can't think that we're going to make all of this change, dismantle racism, and quickly, we're going to find that Black people are now seen as just citizens and are going to be treated fairly and rightly, when it's going to happen under the guise of the election changing and the politics and congressional services. All of that has to come into this conversation as well. So it is super important for people to recognize that and to exercise their right to vote, and to make their voice and their vote heard in all of this, because none of these changes are really going to take root without changing things on a bigger level as well.
I want to just follow up to that, Dr. Hudson. You said that it's more than a moment; it's a movement. So that gives a sense of how big this is, this big change that you're talking about. And I think our listeners who have been tuned in, just a person listening to this at home or, on a lunch break or something, thinking, what can I do? How can I actually be involved? Because we've heard from so many people that support the work we do. They've asked this question, like, how do I be a part of this? How do I make change in my community? What do I do? How would you reply to those people that have good hearts and good energy, but they're just saying, where do I put my compassion? Where do I put my energy towards such social justice? How do I do this?
To those people, I would say, try not to get overwhelmed with how large the task is at hand, but really think about from your place, from your space, where you are, what you can do. Find your passion. What are you passionate about? Find things that you're interested in. Find your purpose or your calling. When I think about myself, again, it goes back to, I had to get more involved in my community. I had to really work with law enforcement here. I had to try to improve the relationship between law enforcement and the community. Did I want to do that? Not necessarily, but I had to. I was forced to. So the time was right for me to have to do that. Education, as you said, is very important to me. And so as an educator, where do I put my energies? My energies have to be about changing other people so that they can in turn change other people. And it can be a cycle of change that happens over my legacy. And so for anybody, I say, find your place in your space. Is it tutoring the underserved in a community where you are? Is it signing petitions? Is it participating in a protest march, in a non-violent way? But, again, I just have to say, I think that these opportunities are abound. They're right in front of us if you just think about, again, what you're passionate about, what you're interested in, and what you think your purpose and your calling is. You will find something that you can hold on to and that you can do in society to try to help build a more equitable and fair society for all of us, our citizens.
I love that response, because I feel like that's what the average person wants to know. That's what, the people we meet in the markets or in the stores, our teachers, our nurses, or whatever, want to know. How do I get involved? And I hear you saying, find your place and your space. I love that. Your talent, and serve, like you said, tutoring a young person, mentoring, or what have you. I think that's really powerful, and that goes a long way, is what I hear you saying.
And to that, I would also add, even about the education, it's important to educate yourself. Educate yourself about what's going on here. What is racism? If you did not understand it before, look at what's happening around you every day. Learn more about this. Read about this. Try to deal with and address your unconscious biases and your discomfort with the things that are happening, because the change will start with you. And you won't be able to find your place and your space in what you're going to do until you begin to really recognize that these are true injustices that are happening all around us.
Hey, we can't hear you.
Can you hear me now? I'm sorry. Okay, I was saying that I want to put a pause on my questions. I have more questions, but I want to I want to open it up to our listeners, so that they can talk with you and ask some questions of you and tap into your expertise. Jess, are you there?
I'm back.
Oh, you're back. Hi, Jess is back. Yes. Do we have any questions for Dr. Hudson?
Yeah. So throughout this whole discussion, I've realized how lucky I've been to be able to really watch these webinars rather than, G is doing the interview. And I'm telling you, I'm literally taking notes the entire time because I'm like, back to the education thing, learning myself and learning from all these amazing people, that I've been lucky enough to work with throughout this series. So that's the first thing I want to say is thank you. At this time, we will open it up for questions in the Q&A. I don't have any as of right now, but I have a few kind of that I've come up with just from listening, if you're okay with going over some of those. So I want to go back to the conversation about language. Changing the language is so important. And I know my family and I have conversations almost every night about all this stuff that's going on, and language is definitely something that has come up. And I think my dad, who is a very lovely person and very open and very welcoming to every type of person, sometimes I'll give an example. I was redoing my room last weekend and he said something, he made a joke of, and I don't mean to bash my dad on this series, but he said something about me going to Lowe's instead of Home Depot because Lowe's was for women and Home Depot was for men. And I said, Dad, first of all, what do you mean by that? What is your reasoning for that? And he was saying it in his mind as in a joking way, but I said, you have to understand that, one, anybody can go to any store that they want and it doesn't really matter. So anyway, my point is that this has been on the forefront of my brain of kind of recognizing what language I'm using and helping the people around me to realize, even if they're trying to make a joke or not realizing that it could be offensive, it's definitely something that I am aware of, more aware of now. So my question is two things, kind of a two-part question. How do we necessarily
She's a little frozen. Is she frozen on your end, Karen?
Can you hear me?
Now,
I can hear you now.
Now,
Hear her.
you froze up for a moment there.
Okay, so my question, I'll go back. My question, the first part of my question is how do we kind of know the best and most appropriate and the non-offensive language to use in these conversations?
The best way to work with this is if you don't know, ask. I'll give you an example. I work with the homeless population, but I don't call people homeless women, homeless men, homeless fathers, homeless kids, because that really labels them. It doesn't speak to who they really are as people. The homelessness is secondary. They are people who are experiencing homelessness currently. This does not have to be a lifetime sentence for them, and it really, again, does not equate to who they are. So even if they don't encourage you to change the language, it's important for us to change it because it's more empowering for people. If people are constantly listening to language that is belittling and stigmatizing, it really goes a long way to disempowering them and helping people to feel worse about themselves. It just does nothing to improve one's self-esteem. So I think when we're not sure, what we should do is really think about ways to say things so that they are more strength-based, And if we're unsure, ask people. Ask people. Don't make assumptions.
Definitely. I totally agree with that. Kind of.
Can I have a follow-up question to that? Because Jess is raising a good point, and I love your response to it. But what would you say to people who, because we get this sometimes, well, I'm afraid to ask a Black person, you know, about X, Y, or Z because I don't want her or him to think I'm, you know, being insensitive. But what you just said is that it's better to ask. Can you just talk about that? Because I think that's a practical problem that people in real situations experience.
No, I think you're right. I think it is a practical problem in a situation. And the way I would frame this is, again, it's all in the way you speak to people. You don't want to ask a Black person something and think that a Black person is supposed to answer you or supposed to be talking on behalf of the entire Black race, but you can preface your conversation or your question into your inquiry to learn, and you don't mean to be offensive, but you were just wondering X, Y, or Z. And I think, again, when you frame it in that way, most people are interested in answering a question because it is about educating you. And if you come humbly to people with that sort of a stance, I've never seen people not want to give out information.
I think it's when you say that, I think like how you approach people is what you're saying makes the whole difference. It's not even a question that you're asking, you know, oh, do, you know, so-and-so do such and such, or do Black people love this or hate this? It's how you say it that makes the big difference. And to Karen, I would say this, do most people of color, just generally speaking, we can't speak for everyone, will welcome that if it was said in the right context.
From my experience, and again, I'm not trying to speak for all Black people either, but what I can certainly tell you is it is not just how you approach, but it is how you approach. It's approaching with a sense of humility. If you approach somebody with an attitude of, again, a stigma or an assumption that you're making, people can read that. They can read the vibe, they can hear that, and that will turn people off. They will not want to necessarily feel like they have to educate you or entertain you. But I do think if you come with a humble spirit, asking a question that really is about educating themselves, most Black people will want to answer that question to help you along this journey. But it's also important for you, the person who's trying to learn, to not feel like every Black person should answer the questions for you and give you all the information and the education. There are lots of ways and places that you can get education, by reading, by listening to webinars. There are lots of other things that you can do. And if education is really what you want, then you will do those things. You will do those things.
This reminds me, I know I'm talking a whole lot now, Jess, but this is good. This reminds me of a concept that I just came in contact with a few years ago, that we use in the social justice space. I think in the social worker space, Dr. Hudson, I think they use this too, this concept of cultural humility. Can you talk a little bit about that and what that means? That was like kind of mind-blowing for me as a concept, you know, what that means. I think it's important to our conversation today.
And it is really important to the conversation. And by cultural humility, what I mean is it's knowing within yourself that you don't know it all and expecting that you're never going to know it all. So when you're trying to practice in a humble way and coming with a sense of cultural humility, that's what you're delivering to people. You're delivering the sense that I don't know it all. I'm not going to try to pretend that I know it all. I know I may even make a mistake, but I am saying this is why I'm asking this question, and this is why I'm coming to you in this particular way. This is what I want to learn and what I want to do with it. And I think it's the honesty the openness and the transparency with which you deliver questions and communication that makes all the difference in the world. Do not think that you know it all, because none of us do. No matter how long we're in this work and on this journey, we'll never know it all. And so being culturally humble really means showing people that by what you say and what you do.
Yeah, just to follow up on that, I think we're really thinking about, I want to circle back to building your legacy, your role in social justice. And here's why, because I think as a committee, we've been thinking about this in a very intentional way. How can we make our community better? We love our community. We know there are good people here, good families here. How can we make it better? How can we leave a legacy of service? That whole idea of making the world better than how you found it, you know, that kind of thing. That's what I think our energy and effort is dedicated to. You talked about finding your space, finding your way. I'm still doing that. I haven't completely found my way, but I think the social justice space has really been helpful for us. I think Jess would agree. But why is that important, Karen? Why is it important for the nonprofit communities that you highlighted, for individuals and communities with talents and abilities to build this legacy, to find their space and to build a legacy? Why? Why is that important? Because I can make the case that, you know, my life is pretty good. I go to work every day. I go to school every day. I drive a car. I eat. I fast. Whatever. I run. I'm fine. Why is this important? Why are you telling me this?
Because that's a really good question, G. And what I would say to that is, because it's not just about us as individuals, it really is about the society and the community in which we're living. Our role, particularly as nonprofits and people who are out here within agencies and organizations, to help. It's not to just help individuals, it is to help communities. And if we help many individuals and build towards trying to help communities, we'll have a better world in the long run. And so that's why it's important to think about this, not just on a smaller scale, but on a larger scale. And to that, I would also say some of the ingredients that are important is the cultural humility, of which we talked about, but it's also asking people what's important to them. Not making an assumption, thinking that you know, but really talking to people, allowing other people to have their voices heard. And then when you talk to people, listen with an open ear and not just, you know, be ready for the next question, you know, and just keep talking right over them, but really be willing and open to listen to the answers that people are giving you. That's when real engagement happens, and that's when real change can happen through partnerships with people in the community and with building communities in general. And I think that that's what we need. That's the place where we are in our nation right now. We need to build back better. We need to build a better nation. And the only way that we're going to do that is by building stronger communities.
Gee, you gotta unmute yourself.
I was just saying what I love about that is that the way you just described it, everybody can play a role in that. Regardless of where you are, regardless of how you look, regardless of, you know, your age or whatever, we all have a role in doing that. And I think that that's what motivates me. I feel grateful to be at the YW because we have these kinds of conversations. We get, as Jess said, to have access to people like you and really be inspired to keep doing this important work because we want to leave a legacy. We want to leave our piece of the world better than how we found it. And I think that that's important. I know we're getting close to 1 o'clock and Jess will be, but I wanted to just to ask one more question. We started this interview talking about your work with the homeless families. And let me correct that because we shouldn't label them. You said during this talk, we shouldn't just label them homeless, but they're people. and you talked about how they have traumas. I'm wondering, as we look at our country going through a very important time, we look at people asking questions about social justice. How do we alleviate that trauma from our cultural character? I think the country is experiencing trauma. I know people of color have been through injustices, through discrimination historically. It's trauma. It's not homelessness, but it's the same kind of trauma that the clients that you've worked with, the institutions you've been a part of and served in had experienced. How do we fix that? I know that's a big question, but how do we heal that trauma?
Gee, I think that's a significant question, and you are right. You've hit the nail on the head. We are all grieving as a nation in a lot of ways and going through a collective sense of community trauma. And again, we're not going to change this overnight or heal it overnight, but the first thing that we have to do is just start listening to one another. And again, not just doing it in an empty, superficial kind of way, but really listening to people, asking questions, wanting to know, wanting to learn, wanting to make a difference. And if we're able to do those kinds of things, if we're able to put in the hard work of continuing to engage in some of these difficult conversations, if the conversations feel so hard and so taboo, let's talk enough about them until they feel less hard and less taboo. So even again, just listening to people, getting to know people on a much deeper level. For a white person who feels like, I've gone most of my life and never really had any experiences with Black people or people of color, well, get to know some Black people. Start there. Look for ways to, again, have conversations that are about both talking and listening. And I think that will begin to sort of heal the divide. I'll say also that Maya Angelou, says something pretty profound. She talks about the fact that sometimes a person may not remember exactly what you said to them, but they will remember how you made them feel. And I think if we can all sort of remember that, that's the important piece here, and that goes to, again, this stance on cultural humility. I may not remember exactly what you said, but I remember how you made me feel. And it wasn't that you attacked me. It wasn't that you came at me with an assumption about Black people, but the way you made me feel was that you were listening and that I was being heard. And I think that's what we need to be striving for.
That's community. That's what I'm hearing. That's a definition of community. I love that Maya Angelou quote. I didn't know that, but yeah, you don't always remember what people say, but you remember how they make you feel. And we all have feelings, everybody, So no, that's really powerful. Jess, did I overspeak?
Second part of the
My bad. I messed it up. I was just getting caught up with talking and learning. But yes, I'll turn it over to Jess.
So at this time, I'd like to thank Dr. Hudson again. I feel like, again, this is all we just talked about from my notes. So there's a lot more that we could go on, but I know in the interest of time,
yes,
we'll have to cut it off. But thank you again for being here. And for all our attendees, I just want to say to keep your eyes peeled for upcoming sessions. We have some exciting stuff coming up. And to spread the word, because our attendance has dwindled a little bit, but we want to keep it going and spread the word about these. It's on your lunch break. It's super easy to tune in and gain some really important knowledge. So spread the word, and we appreciate, you being a part of this. So
I want to ask, am I muted?
No, you're good.
So I want to put Dr. Hudson on the spot and ask her to come back at some point and be a part of this. We would love to have you. And we want to reach out to speakers that have been a part of our series. I think Jess has been working on that. And we would love to have you back to talk more about this. And just in closing, if you had anything that you wanted to say in closing, I'm putting you on the spot, but I think what you said today was really helpful for us, and we appreciate it. But I wanted to give you the floor.
Thank you so much. First, I just want to thank you for inviting me to speak today. And again, I think I just want to underscore the fact that the more we have these conversations, as hard as they are or feel, the easier they will become, or the less uncomfortable they'll become by having more of these conversations. So on that note, I'd be happy to come back, at some later point and continue this conversation, because I just don't think that we can talk enough about these things. And I think that every time we talk about things like this, we learn new things if our mind and our heart is open. And so I think that's the spirit in which I just want to encourage everybody to come to the table to have some of these conversations and participate. When you see something in the community that doesn't make sense, ask about it, call it out a little bit. And again, I think that we all need to be about educating. It's not just the educators who should be doing that, but in order to be an educator out here educating, you also do need to educate yourself just a little bit. And so again, I think that's a responsibility that we all have as citizens, to do that. So I encourage everybody to do that.
Yes. Thank you, Dr. Hudson. Jess, are we good? Anything else?
Nope, I think that's perfect, and we're right at the perfect.
We went over a little, well, we're good, right? Okay.
Again, stay tuned for
Yes.
our upcoming sessions.
Yes. Thank you. Thank you, Dr. Hudson. Bye.